The 5-day forum gathered a team of researchers and PhD medical candidates from the Digital Diagnostic for Africa, an interdisciplinary network who are on a quest to come up with new approaches with a view to improving how medical tests are conducted in Africa. The co-lead of the National Institute for Health and Care Research Group underscored the main purpose of their research interventions.
There's a massive need for diagnostic tests in Africa. It's really alarming to read reports from the World Bank and other organisations which have done surveys that show that more than 50% of the population in Africa don't have access to diagnostic tests at all. And even those that do often don't have access to the essential diagnostic. And we have a real problem that we all have heard about, which is the overuse of antibiotics and the bacteria that cause infections becoming resistant to those antibiotics. So by having better tests, we know who needs antibiotics. We only give them to the people who need them.
The unit director of the Medical Research Council, Umberto de Alessandro, outlined ways in which outcomes from the research could be useful within the health systems.
This test can be used also for other diseases, for example, at the level of health facilities, of hospitals. For example, one of our other approaches to see whether we can use this test to distinguish between bacterial infection and viral infection. Because if you have a bacterial infection, you need antibiotics. If you have a viral infection, you don't need antibiotics. So in a way, it can be the results can be quite heterogeneous.
The chief medical director of the Edward Francis Small Teaching Hospital harped on the crucial impact and benefits of the research to the research unit of the Edward Francis Small Teaching Hospital.
We work closely with the researchers because at the ministry we develop the policies. And if you look at the research that's being done, they are going to be very helpful for Africa because they are going to make very difficult diagnostics that you usually do with a lot of machines. They make it easily so that you can do it at the point of care. So when it is very successful, some of these tests you can do it in the villages easily. So it's going to make life easier for our people. So we are always appreciative of the collaboration, and we have a research unit, and then we always are involved in the discussion before any research comes to the country. And we have to know that it's going to be beneficial to our people and not harmful before it is usually approved.
One of the participants, who is a PhD candidate at the University of Ghana, also shared her impression of the research, describing it as a vital step towards improved healthcare delivery.
I think the main challenges we have is trying to find diagnostics that can be used in rural areas, because so far I think the best thing so far has been the malaria RDTs that we've been using. And if we are able to find more of such devices that are very easy to use, simple to use, and without a lot of resources in most of our remote areas, that will actually be a great idea. And so my expectation is that the contribution I am making from the research I am doing will actually be able to help people in these rural areas.
Those participating in the research forum are hoping to bridge diagnostic gaps within the African health system in response to challenges posed by insufficient health equipment in laboratories. Omar Faye, GRTS News.